You hear me okay? I have a loud voice. Before we begin, I must let you know about something that happened yesterday. Awful to me. Awful at the time, yet funny. I can laugh now about it. I love Mexican food. Mexican food does not love me. I usually get mango pollo, which has got a little bit of red flakes in it. But I think on Monday evening, the chef must have had Parkinson's disease because it was filled with red flakes, and that does not go down well with me. I was in Sam's Club yesterday with my wife, shopping, and I had to go. And I was at the far end of Sam's Club where the TVs are and the dog food. I go to the dog food area because I have dogs, Michael, in case you're wondering why. The toilet's at the far end, so I'm having to run down there. I'm having to run from the knees down. I get there, opens up, the first thing I'm pushing on the door, there's somebody in there. Oi, I'm in here. So I go to the next one, but not a moment too soon, get there, and oh, blessed relief. Now, you've all done range of motion here, and you know when you're doing somebody's legs, you raise the blanket, and your nose tells you something's not right. Well, multiply that by 10, and there's a guy next to me. He's the one who I almost walked in on, and his foot is in my end cubicle at that angle. Well, maybe that angle. No, it's that angle. And he's there, and after the aroma had occurred, he was like a bat out of hell trying to get out of there. Pulled his pants up real quick, the door slammed shut, and he's out of there. I don't even think he washed his hands. But to make it worse, and this is Sam's Club bathrooms, there's no toilet roll.
Oh, no.
And I'm just this can't be happening to me. But my wife called me and said, those immortal words, what are you doing? I said, I'm crapping my brains out here and there's no toilet roll. So my wife, fast thinking, she comes in quickly, knocks on the door, and I say, it's just me. And she stuffs it over the top. Some kitchen roll. The brawny. And believe you me, it doesn't mop up at half it's supposed to do. So anyway, my wife, sorry. Put that one. But anyway, that's just neither here nor there. I had to mention that to you. Pardon? But here's my introduction, right? This was supposed to be a bit of light relief for all the hard work we've been doing over the past few months, years really. But the more I got into this subject, I was amazed at the amount of literature, research, papers done by famous people, academia. That's learned people, Michael, for you, okay? Academia, all these people, there's just rounds of it, all from established universities, Oxford, Cambridge, Harvard, Yale. It was like an onion. I just kept peeling it back and there's more literature. And it was just so amazing. I mean, it even goes back to the days of the Bible. And we'll get to that shortly. But I need to thank Cara for her help. She's helping me because it's interesting subject matter. And next week's her assessment, so she needs a good assessment. So, not right. All right. So, here we go. The subject is laughter in medicine. We've all heard the phrase, laughter is the best medicine. Who said that, Joanne?
You just did.
I just did. Well done. You got that one right. But in fact, who actually did say it in the past, Cara?
It was actually in the Bible, as Paul says, Proverbs 17, verse 22. A merry heart really does a spirit, soul, and body good like medicine.
And that's way back in those days. No cars, people rode around on donkeys. You know, times were hard. You just had to laugh. So what is laughter? What actually is laughter? It's a reaction, physical reaction of rhythmical contractions of the diaphragm in a response to internal or external stimuli. That we can now progress to the world of science as to what works with laughter, can't we?
Mm-hmm. That's true. Wait, okay.
Yes.
This is well rehearsed.
Okay, yeah. Okay, it produces natural painkillers. It releases endorphins, which we know of. Runner's high makes us feel good, relieves pain and stress. And according to the journal Neuroscience, social laughter can release endogenous opioids and endorphins. So who needs drugs?
You've all heard of the runner's high. All you athletes here, you run your 50 miles, your 50Ks, your marathons. It hurts, but then endorphins kick in. These are your feel-good hormones, right? So after you've run your race, you've finished your race, you feel great because that's the endorphins kicking in, which is the same thing which makes you laugh. But once the pain begins to take over, the happiness wears off, then the ache of that run kicks in. But that's what the aim is of laughter, to try to increase those endorphins. So, that. Not laughing, if you're one of those miserable professionals here, not in here, but there are some here I could name, and if one of these doctors was to walk into my room, I'd tell him to get the heck out of there. Not laughing can increase loneliness, it can increase social isolation, and it may even increase the risk of dementia. Hopefully I'll never get dementia. That came from the Japanese Geriatrics Society. I read that magazine just last week. No, I didn't. Sorry. But more on that later. Okay, so how does laughter help in medicine? There are many benefits. It's amazing. We're going to go through about 8 of them, but there's about 800 benefits, according to all the various literature. The first one, it can improve the mood. Anxiety, stress, that awful word, stress. You actually feel it, stress. Nobody comes into a hospital, they don't want to be here. They're here because they're ill, they're hurting, they need surgery, various reasons. They don't want to be here. You don't wake up one morning and say, oh, I think I'll go and have my abdomen cut open, or I want some of those fecal management systems shoved up my ass. Ask me questions at the end, please. Okay? So nobody wants to be here. I mean, somebody with more time on their hands than needed asked 100 people where they would rather be. And oddly enough, a hospital wasn't on that list. Vacation was way number 1. The hospital was not on there. Let's see. As mentioned earlier, laughter can increase those endorphins, which helps you laugh, smile, feel better, and gets rid of that awful word, stress. I tell you, there's some awful words in medicine. Stress. Scrotum. Where the hell did that come from? It's a horrible word. Some bad words in medicine. Next, Cara.
It can improve the immune system. According to the Mayo Clinic, positive, happy thoughts release neuropeptides. Sorry, I can't talk whenever I speak in front of people. While we're laughing, natural killer cells that destroy tumors and viruses increase, as do gamma interferers, T cells, and B cells, which make disease-destroying antibodies. Paul,
Thank you,
back to
Cara.
you.
Thank you, Cara. Third one, pain relief. While you're it's a very common factor that whilst you're laughing, you're not hurting. As mentioned earlier, laughter releases those natural painkillers, analgesics, endorphins. And laughter can help with long-term pain, according to the European Pain Federation Congress held in Italy, which I went to last week. No, I didn't. No. In Switzerland, Thomas Benz at the Rehab Clinic in Bern, Switzerland, he thinks that humor intervention should be in all parts of therapy. So, and the laughter, by the way, needs to be real laughter, not the false laughter that you might just put on if you're laughing at somebody's joke that you don't get. It's got to be real laughter for it to work. All right. Sorry?
I said, where's Robin? He knows what that feels like.
Right. So, real laughter. Then, next one, Cara.
It also improves heart health. According to the University of Oxford, they did a research study where they took 50 patients with mild hypertension to a comedy club. No alcohol was allowed. And after the show, 80% of the 40 patients had lowered their blood pressure, at least for short term. Have to be careful though, because you've heard the phrase, laugh until it hurts. Too much laughter or hard laughing can raise your blood pressure. So, fine line, or even muscle strains. Okay.
And going on from there, laughter maintains a healthy endothelium and decreases the risk of cardiovascular problems, strokes and heart attacks. Happier people are normally healthier. And I think you've noticed that. Well, hopefully you have. Fifthly, surprisingly, weight loss. Dr. William Fry of Stanford University, Stanford, he says that laughing heartily 5 times a day has the same effects as 15 minutes on a rowing machine. How on earth he got that, I don't know, but that's what he got. Which equals losing, he says, 15 minutes of laughter can burn 50 calories, which equals 4.4 pounds a year. Which is not very much, but if you do it over 10 years, you've lost 40 pounds just by laughing. Obviously, he's got more time on his hands to work all that one out. We go to Dr. I've got to say these. Murakami and Dr. Hitoshi Ishii at the Tsukuba University in Japan, which I went to. No, I didn't. No. He says that laughter can actually decrease sugar levels, blood sugar levels, which helps diabetes, which helps weight loss. Not to be confused with the same professors who do dermatology. That's Professor Itchy Kuchi and Dr. Hitchy Butty. You don't get that one? All right. Next one.
Laughter makes healthy relationships. Laughter is infectious. Laugh and the whole world laughs with you. Weep and you weep alone. Who said that? No, some random Ella Wheeler Wilcox lady said that in a poem called Solitude.
I think laughing at your wife won't work.
That's true.
Laughter actually helps loneliness. There's a tale in New Orleans. There was an older woman. I don't know. I don't know how old she was. She was the kind of person that you say, oh, look, there's an old woman, right? She was a recluse, and the Adult Protective Services put her into a nursing home. And she wouldn't venture out of the nursing home at all. And a psychologist who was apparently on her case, he noticed that the nursing aides and nurses went in, they were miserable. When they came out, they were miserable. So he got some of his students to act as nurses and aides and go in there and actually have some fun with this lady. I don't know what they did, but they said after a month, this woman began to come out of her room to eat. And within 6 weeks, she was taking part in the nursing home activities like bingo and things like that. So just by changing somebody's mood with laughter and things like that can change a person. And it just helps overall. Cara.
Okay. Overall, laughter helps you live longer, especially women.
Mm-hmm.
Why is that?
I don't know, Cara. It must be genetically. I didn't get that far into that one. I didn't get that far.
It's a factor to aging and good health, according to the International Journal of Epidemiology.
Did you also know that researchers at Harvard have estimated that a medical professional, a doctor, a therapist, has 45 seconds from walking into a patient's room to create a first impression? 45 seconds. It's not long, you think about it. But that's the impression. If the patient is nervous and they don't know who's coming in, very often it's someone with a sharp needle, whatever, they're anxious. So you've got 45 seconds to create a favorable impression to try and get that patient to work with you, or the family if they're in there as well. And I found that rather amazing too. It's 45 seconds. And that would help with things like compliance, get your patients to comply with you by being on their side, by making them have fun, making them look forward to you being there. Helps compliance. And as Kara said, it helps you live longer. But there are some disadvantages to laughing as well. Number one, choking. If you're eating and you're laughing, you can choke. Number two, snorting. You can laugh so much something comes out of your nose. I've seen that. Asthma attacks, severe laughing. And lastly, incontinence. Hopefully you can laugh until you actually have an incontinent episode. Okay, in conclusion, all right, we are lucky we can get to work with these patients. We make a difference, enjoying our job. If we enjoy our job, that overflows with these patients too. And you may ask, is there a role for laughter in medicine, like in pediatrics? Well, yes, there is. Kids love to laugh. What about geriatrics? Well, yes, they're just older kids. What about in a hospital? Yes, I mean, everything kind of helps. What about hospice? How many people here have actually followed one of their patients to hospice house to actually see them? And the families light up because somebody's come there who they've liked to work with. It makes a difference. So we can make a difference by just being a ray of sunshine in somebody's life.
You've done that, haven't you, Paul?
I've done that several times. Been to hospice house. I don't mind going there. The families love it. Yeah, because they're all sad and it's just a break for them to have somebody that they've known the patient has liked, who's actually gone there to say hi and maybe farewell. But the patients love it, and so do the families. It makes you feel good too. So by being what we are, we can both help the patients and help ourselves too. Any questions? Why am I so wonderful? I don't know.
Yeah.
No.
Thank you, Paul.
Any questions? All right.